Okay, so evaluation of a patient. If a patient comes to you with an isolated, mild, chronically elevation of serum aminotransferases, which are ALT and AST, so the initial evaluation you will do is that you will review the possible links to the medication, herbal therapies, any recreational drugs a person is using, right? Then screen for alcohol abuse. So remember, whenever AST by ALT ratio is more than 2 into 1, right? Then it's highly likely that the person is consuming alcohol, right? So either by taking history or any screening instrument or AST by ALT ratio. The third thing is obtain hepatitis B and C serologies, right? The fourth thing is that you also have to screen for hemochromatosis, that is iron overload. And for that matter, you need to send serum iron and TIBC levels. If the ratio of both is more than 45%, then it is hemochromatosis, right? The last thing is in the initial evaluation that you need to evaluate your fatty liver by obtaining right upper quadrant ultrasonography, or your AST by LT ratio is usually less than 1, which makes sense as well that the fatty liver, that the person's liver is not working that good, so the ratio will be less than 1, right? Now, if the initial evaluation is unrevealing at any time, then you will step up for a second line evaluation. So consider autoimmune hepatitis, particularly in women and in those with a history of other autoimmune disorders. And for that matter, you need to check for serum protein electrophoresis, obtain ANA levels and ASMA if positive. ASMA means anti-smooth muscle antibody, right? The other thing is that send serum TSH levels if the patient is hypothyroid. Otherwise, obtain the whole thyroid profile, which includes TSH-free T4 and T3 concentrations. The last thing in this step would be that consider celiac disease, especially in patients with a history of diarrhea or unexplained iron deficiency. All right, so serum IgA anti-tissue transglutaminase antibodies. Step number three is evaluation for uncommon causes if the second line is also unrevealing. So, in that case, consider Wilson's disease, especially in those who are less than 40 years of age, right? For that, we know that copper is due to the copper accumulation. So, you have to check serum ceruloplasmin levels and evaluate for the Kaiser Fisher rings in the eye. Consider alpha 1 antitrypsin deficiency, especially in patients with a history of emphysema out of proportion to their age or smoking history, and also obtain the levels of alpha 1 antitrypsin. Also consider adrenal insufficiency by sending 8 a.m. serum cortisol levels and plasma ACTH levels, high dose ACTH stimulation test. And exclude muscle disorders by getting creatinine kinase or aldolase. Step 4 is obtain a liver biopsy or observe the patient. If no source is identified after all of these above